Wow.
Hello, my name is the Kidney Goddess. Can you see my crown? I had my friend make me this beautiful crown because I am the Kidney Goddess. And you could get one too if you wanted to. Just reach out to me and I'll be glad to hook you up, or maybe I'll even do one for you myself because I do jewelry. So we'll see. So anyways, let's get down to the important stuff because I have a really important person here today in my life, and she's got a really important message. And her name is Tine Kelly, and she is a nurse practitioner. And I'm just going to tell you a quick history. I'm not going to tell you too much. Hello, Mr. Bruce.
Okay.
Bruce is in the house.
Very good.
And I met her when I was not doing dialysis. And guess what I said while I was not doing dialysis? And I learned that I had kidney disease. When it's my time, I'm going to go away. I'm not going to be on earth anymore. And I'm going to go on hospice. So I'm not going to do dialysis. I'm not going to do transplants. And if you stick with me, you'll learn that I have a lot of bigger stories about that. But for right now, let's just say that. And then my son came to me and he said, you got to stay on this earth. You're too much fun. You bring too much joy into this world and we need you. So guess what I did? I changed my mindset, changed my behaviors. And this lady went along with the roller coaster ride with me. Her and Dr. Garrick from Metrolina Nephrology said, we are here for you if and when you are ready to do dialysis. So she's seen the best and the worst of my situation. And she's just lovely. And she is going to talk to us about COVID, because guess what? Who got COVID? She did. Guess who got COVID again? She did. And now she has long haulers. I don't know if anybody has heard about long haulers, but she's going to tell you about long haulers. And it's so important as kidney patients, or if you're not a kidney patient and you're listening to this, especially with some of the meds that we're on and our immunity system is down, that we hear this, because you know what, from what I'm understanding and what I'm hearing about the research, the numbers are going up and I'm starting to wear my mask again. So it's important. So without further ado, this lovely, lovely lady, Ms. Tine Kelly, is going to talk to us today. Hey, Tine.
Hey, Beth. Thank you for having me on your podcast. I appreciate the opportunity. I was just going to give a quick little background on myself. I have been a nurse or in the nursing field greater than 32 years, most recently as a nurse practitioner in nephrology for nearly 9 years. So I'm very passionate about being a nurse. I've always wanted to be a nurse since I was 3 years old. And I think it is such a privilege that we get the honor of taking care of patients.
It is so nice to hear, Tine. So nice to hear,
Yeah.
because I think so many people are burnout right now and everything in the healthcare field. And sometimes they're just doing what they can to survive too. But it's important that they remember that. And it's important that we remember that they're going through this.
Yes. And one of the things I was going to kind of help you learn how to maybe be a better, improve the care you receive by being a better patient, learning how to ask for what you need and communicating that better. And I'll kind of set the stage with the state of current affairs on healthcare workers, and then on yourselves as patients, and then what can we do about it? As Beth said, I also have a chronic illness. I have long haulers, which is basically COVID that kind of doesn't go away. I was diagnosed with my first bout of COVID. It'll be 18 months next week. And afterwards, the 10 days and recovery, I had a kind of reactive episode where my whole body kind of went into disarray. And we didn't know it at the time, because this is like January 2021. We thought only the people in the hospital were going to get complications. I had a moderate case of COVID, stayed at home because I was working in the hospital and I knew there was no room. And what were they going to do for me? So the process has gone on. I have many symptoms, unfortunately, still, one of which you may hear me coughing today. I cough frequently, and I will be drinking water as well, just to kind of help me get through the talk. Long, long COVID, post-COVID syndrome, there's many names, but basically, if your norm was XYZ, and if you were diagnosed with COVID, or even if you weren't actually have a positive test, but felt you had COVID, there are many people in the United States, anywhere from 8 to 40 million, that might have some form of long COVID. So let's say before you got COVID, you were yourself, no different problems. After COVID, you did okay, but then you had, let's say, severe pain in your hands and in your joints that you never had before. They tested you, and there were no other explanations for the problem. COVID is when there are symptoms that are unexplained by any other form, any other cause, then that is attributed to your body's reaction to the COVID. So that's in a nutshell what post-COVID is. I have had to resign from my position as a nurse practitioner because of the complications from COVID. And then in January of this year, I got my second COVID. And once again, about 10 days later, had a reactive episode and had a severe asthma response, and then more complications. And I am fortunate enough to now have complications from post-COVID, which most people don't even know there's post-COVID. Now we're actually seeing complications from post-COVID. I've had this bad cough for 18 months. That has caused problems with my body. So that's a complication from the post-COVID. So we're going to learn a lot from people like me. One of the things that, as a provider and now as a chronically ill person, it's been very enlightening for me, and it's helped me be a better provider. And that's kind of what I want to share with you guys today, is how can I help you through my process? So how can we improve the care that you receive? Unfortunately, times are changing right now. We're in a new era. The current state of health, the effects on patients, and what can we do about it? You know, it's still kind of up in the air. Today, I want to briefly go over those things and how can we make that work for you? The current healthcare crisis, what has that done to healthcare? You, especially, as well as myself, have seen high numbers of patients in your facilities, at the offices, or in the hospital, and low staff. You've seen high demands and less time for the providers, nurses to spend time with you to get those demands met. You've seen high stress and low satisfaction, high cost and less reimbursement. We've also seen that it has affected the providers, the caretakers, the techs' ability to manage and care for us as chronic illness successfully at times, which has increased their frustration and decreased their job satisfaction. That's important because it affects you. Now, let's kind of briefly look at, and these aren't all of them, but let's look at the effects that this current state, how does that affect you? One, there's decreased efficiency delivered to you, increased dissatisfaction in overall healthcare. I don't know many of my patients that I still talk to, or I still see, or that I, as a patient myself, there's a decreased satisfaction in overall healthcare right now. It is also, if it wasn't difficult before, it's even more difficult to be able to navigate the care that you need. It is very confusing, and that makes it harder on you to get the care you need. I hear often that patients feel unheard and lost in the system. Mm-hmm. and where to go and who to see. Again, everybody is so heightened in their workload that we don't take the time to remember it is a privilege to care for patients. And it is disheartening for me as a nurse to see so many in the healthcare field dissatisfied and disheartened, because it is a wonderful, wonderful career. But there's overall decreased support for you through this challenging time. So what's the goal? So we know that there's increased patients, decreased time they're able to spend with you. So how can we make that time work when you're in front of the nurse, the tech, the doctor, the nurse practitioner? Excuse me. We want to be prepared. I myself, and nurses make horrible patients. Today I had an appointment and I was on my laptop. I printed out Excel spreadsheet of my symptoms and how does that affect my life? And they just have learned to laugh at me because most of them I know personally. But so be prepared. What I mean by that is, are you educated about your kidney disease? Do you know what you need to know? If yes, that's good. If no, you need to learn so you know how to help yourself. Where do you learn? How do you learn? The National Kidney Foundation is a great resource for patients. I would be careful of Googling things on the internet. You want to go to trusted sites. So sites that are national foundations, large hospital systems that have support out there. You don't want to go to Joe Blow's kidney group and get their information right away. You want to get the most current, most accurate information first. So ask your dialysis unit if you're in dialysis. Ask the office if you're in the office or in the hospital. Be active, be proactive for yourself. Then second, am I doing what I should be doing as a kidney patient? I will tell you that it is very difficult to be a kidney patient, as I have seen as a provider. I am not, but I have seen the struggles that hundreds have had with the what can you eat, what can you drink, when you show up, what medicines to take, when. I mean, we take control of your life at times. So that's difficult to sometimes go and do what we want you to do. But if you want to use the time well, you need to be doing what you should be doing: diet, fluids, medications. As I said, it is difficult and we understand that, but it's kind of like having me treat you with my hands behind my back. You want me to help you, but if you're not doing the recommended things, then I can't change you. I can't, so again, kind of be mindful of that. And again, we are understanding of the huge commitment that you're doing to have kidney disease and what that entails. Also, take a time to list what your problems are. What problems am I having? And then more importantly, how does that affect your living? I'll give you one example for me. I have extreme fatigue. So I go in and I list all my symptoms thinking I'm Miss Hotshot, just have them all listed. And they're like, really? You still have that? Really? You still have that? But you went through this and you went through that. And I'm like, you forgot the part, I got it again. And then we had another reaction and it kicked my butt. So then I thought, I'm not being a good patient. I'm not telling them how this affects my life. And it's weird, in the role I play as a provider, I'm used to saying, sit down and listen, eye to eye on your level. How's that impacting you? But I forgot to do that for myself. And the majority of providers don't automatically do that. So that's why I did what I did and wrote down all my symptoms and how that affects me. So extreme fatigue, it gets worse when I do activity. And It gets worse if I'm stressed. It gets worse if I'm cold. And unfortunately, with post-COVID, you don't know when you've pushed it too far until, for me, it's the next day. If I pushed it too far today, I will be in bed the majority of the time or extremely tired. So I need to say, hey, my fatigue impacts my functional status. It affects, sorry, my cognitive skills are a little challenged. It affects not only my functional status, it affects how I feel about myself. It affects what I do, how often am I getting out. So it plays a huge impact on my life. And I wasn't communicating that well. And I want you to be able to do that because it makes a huge difference. If we want to use that few minutes that we have when the provider comes by, hey, how are your labs? Or how are you doing? Then let's say, hey, this, and this, and it is affecting me this way. Now, I do want to say with caution, remember, medically, what you want may not be what's best for you. And you have to understand that. We have an oath to do what's right and to cause no harm. But the goal, again, is how can we make this work for you? So you want to spell out your symptoms and how it affects you. And then say, all right, what can we do about it? When you use we instead of, hey, what are you going to do about it? It actually shows the provider, the nurse, the tech that you are part of your care. You are holding responsibility. And as a provider, that is such a joy to have someone take ownership and be part of the team. Yes, I work for you, but I need you to help me be better. So that I think is very important. So kind of guide these, this is what I have, which bother me today. This is how it affects my life. And what are we going to do about it? And then allow them their expertise and knowledge to kind of play along with you. You have a role in your health as much as the provider does, as much as your team does. And what I do like in the kidney world is that there are a team of people to support you. Whether you're in office, there are doctors, nurses, lab technicians, all that are part of your care. Utilize them. Learn about your disease. In the dialysis unit, we are so blessed that we have the nurses, the techs, the social workers, the dietitians, the facility administrators. Those are all people on your team. And when I introduce patients to the unit, I always say, you have a team. Or when I start someone in the hospital, and of course that terrified look of, oh my God, is this real? I say it will take a while to get used to this, but you have a team of people for you to help you get through. Now that team needs to know what's going on with you in order to help you. So again, these times are changing. We don't have a lot of time to spend like we would like to, but we want you to use that time well. So you help me know what you need and we get that done for you. So that's kind of the basis of that. And again, through my personal experience with post-COVID syndrome, I have seen that. And I know that I am much more fortunate than many that my symptoms aren't as worse as some others. But another blessing is that I knew the providers and they knew my normal. So I didn't have to convince them I was sick. They had to convince me because I didn't see it. So that's an advantage that I have that many others don't. So let your provider know what's going on. Act involved in your care. Try to do your part as well as you can, because it's only going to improve your health and your outcomes. So that's kind of my 2 cents on that. And I'm so much a patient advocate, and I wanted the ability to share that with you because it is a very difficult system to navigate. And there's always something out there. It's just learning how to get in contact with that. So ask your team at your dialysis unit, ask the nurses, the staff, the doctors, ask. ask what you need, or ask what you're waiting for, or ask what you're missing. And then that lets them know where to plug you in. So that does help. Again, it is an unfortunate time in healthcare. And I think we will have some type of COVID with us for a long time. But if we learn to do the best we can and guide our providers to what we need, I think we can have some better outcomes without changing the system in a major way.
Thank you so much, Tina. This is just wonderful information that needs to be said and needs to be heard. So I don't think you spoke about the vaccines. Did you get any vaccines, and how do you feel about the vaccines?
Actually, I got my second booster today. So thank you for reminding me of that. This is how I feel personally. My career is to help people get better, to take the best care of them. So I feel it is my obligation as a provider to take vaccines, boosters, when I am able to do so. And even though that might not 100% protect me from giving you something, it's doing all that I can to do that. Again, there are many, many different views and opinions on this. As kidney patients, you are immunocompromised. So you are at what we call a high risk. High risk people, we like to have them vaccinated to give you every benefit. If you do get it, then hopefully you will have a mild case. I will tell you, in my personal experience in Concord, North Carolina, when I was in the hospital, at record numbers on our kidney list, the patients that were the sickest and the patients that died were the ones that were not vaccinated. And I'm not talking, somebody 85 years old. I'm talking a 30, 40-year-old, fireman or police officer or a young man. And that was so disheartening. And there was a husband and wife that had at least 3, if not 4 children, both pass away, and both did not have the vaccine. As a healthcare provider, that angers me that those children don't have their parents. And I know that wasn't the goal of them not getting the vaccine. They had personal feelings against that. But as for me, and what I feel my role is in healthcare is to protect you, not to cause you harm. I feel that it is my obligation to get vaccines to protect you as much as I can.
So I don't want to get into too much of an argument in this situation, but, what do you know about the science that says this is the right thing to do to get vaccinated? And what do you have to say to people? They say, well, they don't know what they're doing. Look at that guy. Fossey, is it? Is that pronouncing his name correctly?
Yes.
I think so. Okay.
Yeah, it's something like
that. Let's hope I
am. The word right now.
And, he's told us back and forth different things, and people are saying, well, look at, even they don't know what they're doing. So what do you have to say about those two things?
And I am not an expert at all on this, but I will tell you, I am so impressed that we were able to come up with a vaccine in such a short time. That means that there are people pulled together in a crisis to try to do something to help people from dying and getting this wicked, I think it's a wicked virus, and it's mutated. I don't even know how many times. So I think we worked together and came up with something that, when stress was on us, we were able to do that. That's phenomenal. That is just phenomenal. We didn't have that when, it took a while with polio and those things. So one, I do kudos because I think they work very hard. Do we know all the complications yet? I would say we don't, but I will tell you, you don't want to have what I have. It affects every aspect of my life, physically, mentally, emotionally, financially. it has taken me out of the career that I love. And I did not, when I first got COVID, there wasn't any vaccines yet. So it's not that I didn't take it, there weren't any. So again, we don't know 100% what the long-term effects are, but I do think that they went through safety guidelines that are there. And I am so grateful that they worked so hard and went through a lot of, red tape to get that out for us. I know that there are some people that have different allergies or different situations that may not be for them. But again, now the numbers are going up, and my neighbor just got it, and she commented, "This is really rough," and it can be. Some people get it, oh, it was fine, but again, I've seen young people get it and die, and the 80-90-year-old live. So it doesn't care how old you are, how small you are, how young you are, how old you are. It doesn't care. It can strike anywhere, anyone, and it affects you differently. So that is what I want to try to preach, is that you want to protect yourself as much as possible, especially for the kidney patient that is already compromised. So that's just my 2 cents on that.
Yes. It's interesting that we're having this conversation back to back with a workshop that I did, and it was the storm that cleared your path. And when a storm comes, it can be disease, it can be trauma, it can be the weather with a tornado blowing your house away, it can be a divorce. So it can be so many different things. When I say a storm, it's just a metaphor for something that you would think is very disruptive, if nothing else, right? So you can also look at it as an opportunity to start over with a positive note. Even though people have gone through hardship with these storms, that it can be a path to a new life, a new way of being, a new place that you're going to go and live. And that was true with me with the kidney disease. I was having my foot half on and half off this earth all of my life with depression. And now I have the depression pretty much under control. And my mindset totally changed 180. So what is your big takeaway for yourself? A life lesson, an opportunity, how you see this thing, maybe something positive that has supported you?
I'm going to say that in more than one sentence. One, nurses are usually caretakers, and that is my role in my family and my immediate friend family. So was very, very, very difficult for me to allow people in. I didn't want people to know how sick I was. I didn't want them to worry. So that I learned, I can't do this. I practice up here, and worked hardest and was leading my team. And when my cognitive things were limiting my strength in that area, it was very humiliating. It was embarrassing. It was humbling. But I have learned that I need to speak up. Like I have told so many people, I have to practice my own advice. I need to have limits. I need to say, hey, I can't do that. I did a talk recently, and one of the things I said is also I surround myself with people that know what's going on. So they were like, all right, I'm hanging up the phone because you're losing your voice, or you need to sit down, or you're shaking, let's relax. So again, the vulnerability that this has put me in has taught me that I have to, I have limits now that I cannot push my way through. Pushing through this makes you worse. And it is bizarre. And my symptoms are strange. Nobody's heard of them. But that, I think, would be my biggest thing, is understanding that I am not myself right now, and that I need to have people help me. I need to have them point out when I can't get a word out. My husband knows. That was the basket. When I'm around people, they help carry things. So that is important, to learn to adapt to your life. And you have done that too through kidney disease.
Mhm.
With dialysis, you guys do that. Again, you are as strong as your team around you. So I'm learning, it just takes me a little harder because I'm, one, a caregiver, and two, stubborn. But that is something that you guys have done for forever. So I'm learning how to do that. So that would be my takeaway. Again, some of the fears that I think my patients have shared with me through the years of, what does this look like? Where will I be in so many years? It is an unknown. They do not know if I'll get better. They don't know if it affects my life expectancy. So learning to live in the moment, I'm not there yet. I am trying, but I think that is what Beth has done very well and continues to work on it. But that's something that I need to learn. One, accept my shortcomings as they are. Two, allow help. And three, to learn to live in the moment.
Thank you so much, Tina.
Thank you.
So may I give you some feedback on that?
Yes.
What if you say practice, research, or experiment rather than saying try? How does that resonate with you?
I like that better.
Mm-hmm.
I like
I'm
that
very
better.
big. I'm very big on language and the language that we use that our mind hears, because our world is going to show up the way that we speak to ourselves and other people. So if I say try, that feels like work. And then Tina knows me, and my work is my play, and I play all the time. So I don't want to try to play. I don't want to try to work. I want to practice, research, experiment, do. And it's not do, be, have. It's be, do, have. In America, we do, hoping we'll get happiness down the road. But if you want to have that happiness, you be who you want to be to get the results that you want. Then you do what you need to do, have those behaviors, and then you get those results. And America has it all mixed up. We're going to wait until retirement. We're going to have all our money in retirement. We're going to be healthy in retirement, and we're going to travel around the world. Does that always happen? No. So be now, then do. Mm-hmm. Yeah.
I think that's a huge message. And again, at 55, I didn't expect to not be in practice right now.
Right.
And like I said, the future is very unknown, but that was the mindset I had. But now I'm learning that wasn't the plan, at least not for now. But no, I like those words. I like those words much better. Thank you, Beth, for the opportunity.
Yeah, yeah. Now, I want to also say that a lot of us, especially women, I think, have a hard time asking for support. We are independent, feminist women. We can do it all. We can cook the bacon, bring the bacon home, whatever that saying is, right? So I had a girlfriend who I went to her workshop, and what she suggested was go to the grocery store. We all have to go to the grocery store. When they say to you, can I help you out to your car, ma'am? If you're going to say no, this time say yes. And then hang on one second, then it gets better. Mm-hmm. Then the next time you go, if they don't ask you if you need help, tell them you would like some support. I like to say support rather than help, however you want to say it. Then they help you out. Then when you get real good at that, are you ready for this one, Tina and Bruce?
I don't know.
What do you think it's going to be? If you go to the store and you get something healthy that's for kidney patients or for you, whatever diet you're supposed to, for right now, I'll just say a gallon of water. That's good water. Go to the checkout and say, I would like some help out to my car, please. I would like some support. Will you take this out to my car for me? So if you're a person who has difficulty with asking for support, asking for help, Doing that process will show you so many things. One thing, keep it in mind, it might help the other person more than you. Maybe they haven't seen the sun. Maybe they're in the lights in there. Maybe somebody's yelling at them in the store and they want to get out of that. Maybe they have something to tell you that they need to be heard. Maybe you have something to tell them that they need to hear. You never know with that interaction with that person, what it's going to do for that person. So you're giving them a gift just as much as they're giving you a gift. Right? And don't have people read your minds. Some people can read your mind, they'll tell you, but most people can't read your mind. So you got to tell them when you want help, when you want something, when it's your boundary. When you have a boundary, you know, it is no, and you don't have to explain to anybody. Now, maybe you have to explain to your boss, or I might have to explain to my friend Bruce over here. But in general, in the public, you don't have to give anybody any reason, especially with kidney patients. People want to know why you're not drinking. Have a drink. It's a party. Have a drink. You don't have to give an explanation. No, I choose water. I choose cranberry juice. So those are a few things that I have to say about that. And you wanted to say something and I stopped you. Do you remember what it was?
Interesting, and learning your limits and allowing yourself to get assistance. I have to decide how I'm going to use my energy. So I have allowed myself to order my groceries online.
Mm-hmm.
And then someone brings them to me
Yes.
and puts them in my car for me. So they shopped, they put it on the belt, they packaged it, they brought it to my car, and then I usually plan it when my husband's home so he can unload it. So, and that makes me feel very good.
Yes.
Again, you know, learning, allowing yourself to make those decisions.
Right. That's so important on so many levels. With your energy, you know, where do you want to put your energy? With your money, where do you want to put your money? Is it more important for you to be cared for in certain ways and you have to spend money on that? Or is it more important that you put your money in the bank? Now, I'm saying that just relatively because a lot of kidney patients have drastic issues with abundance. I'm going to say abundance. I'm not going to say money because money is just a way to exchange. It's Americans and our culture that put the emphasis on the money. In the past, we used to trade, right? So now it's the money. So if we think about it, I think about it more as abundance. If you hold on to your money like this, are you going to get any money? No. So if you receive and give, then that's where the abundance can come in. Again, it's all mindset. So if you say that you're living in lack, you will be living in lack. If you say you're living in abundance, abundance may come in many different ways, and it may just not be in monetary. So with kidney patients, I think it's important for them to take care of themselves and to hear that message also.
Absolutely. Yeah. Absolutely.
Now, you were talking about resources, and I have a big resource besides this kidney support group. My resource is 2 books that I wrote. And
that's right. I forgot about that.
It's very enlightening. It's very inspiring. I had a writer tell me that, Beth, this is scholarly and it should be in every hospital's library for patients and caregivers and providers. And that the name of the book, it's on Amazon and you can always reach out to me, is I'm sorry, I was going to tell you my business name. Never Say Never, Living with Kidney Disease from Victim to Victorious. And in the front of the book, I tell my story, how I was getting out of here. I was happy to get out of this crazy world. I don't want to deal with this anymore. I'm ready to go. And then people say, well, we're not going to let you go. You got to stick around. And how I changed my mind, the process of how I changed my mind and the things that I did. And then in the back of the book, it's all the resources. I can't say all the resources, can I, Tina and Bruce?
No.
But some of the resources, like what is dialysis? What do kidneys do? What is the process to get tested if you want to get on the list? Where can you get abundance from to be on the list because you need money to be on the list? Where can you get those funds? Places that will tax you to death, like Facebook, or other places like the National Kidney Foundation. They have a process where you don't get taxed on it. All these different things are in the back of the book. So even if you're not a kidney patient, if you're going through something and you want inspiration, buy the book. It's on Amazon. And my name is Beth Bedore. My company is called The Creative Life by Design.com. You can follow me there. You can email me at beth@thecreativelifebydesign.com. You can even call me. Well, you can call me Kidney Goddess, right? Or you can call me on the phone. And my business number is 704-218-9885. So if you want to reach out to me, if you want to tell me what topics you want to hear about with kidney disease, if you want to get to know about, more of things about kidney disease, if you just want to chat, I am a life coach. I'm a transformational life coach. I'd be glad to talk to you. So we are so happy that Tina, came to talk to us. And before we go, I just want to know if there's anybody out there that would like to ask any questions or anything to say. Bueller? Well, I guess Bueller is not in the house tonight.
Right.
Everybody wants to be very quiet, and they want to hear what you had to say today because it is so important. And I love you, Miss Tina. I'm so glad that I'm your friend and that you have been my caregiver, and you are an authentic person. You are an authentic, loving caregiver, and you will find your way and you will find peace with this.
Thank you again for the opportunity. I love you, girl.
I'm going to stay on here, but I'm going to stop recording so we can chat if we need to. Good night, everybody, wherever you are, and smiles. Bye.
Bye.